Dr. Steve Tutty discusses how ADHD and autism assessments help children unlock their full potential. One of the topics that many parents, teachers, and psychologists have been focused on in recent years is the rising rate of ADHD and autism diagnoses among both children and adults. For a variety of reasons, including but not limited to more accurate diagnostic criteria and processes, more people are being diagnosed with one or both of these neurodivergent conditions than in the past, with symptoms ranging from issues with executive functioning, differences in social skills, and struggles with emotional regulation. Parents are curious about how best to support their child, and whether or not it's worth it to pursue assessment in the first place. For licensed clinical child psychologist Dr. Steve Tutty, the answer to that question is unquestionably yes. With over 25 years of direct clinical and forensic practice in both Washington and Utah State, paired with over 20 years in teaching and researching in the field, Dr. Tutty is an established researcher and evidence-based practitioner in the field of ADHD, depression, twice exceptional, 2E, and autism. He's had the privilege of evaluating and treating over 2,300 children and adolescents presenting with complex neurodevelopmental conditions like ADHD and autism, and it's clear that assessment is often the first step in helping children grow into their best selves. We recently had the opportunity to speak with him about the assessments, the diagnoses themselves, and his insights from a career helping others. What inspired you to specialize in ADHD and autism, and how has your understanding of these conditions evolved? As I began assessing and treating these conditions in the mid-90s, I discovered that improving the social, emotional, and behavioral aspects greatly improved children's success in school, at home, and their overall self-confidence. It was also at this time that pediatricians were being chastised by the American Academy of Pediatrics for prescribing stimulants to children after a 15-minute consult, and educators for separating children on the spectrum from their mainstream peers and placing them into special education classes. Journal of Developmental and Behavioral Pediatrics. These experiences prompted me to collaborate with researchers and ultimately publish a peer-reviewed randomized controlled trial, Tutty, S., Gebhardt, H., and Wurzbacher, K., 2003, showing that stimulant medication is not the panacea for treating childhood ADHD, particularly given that the prefrontal cortex, the area that stimulants target, does not fully develop until the mid-20s. What are the most common misconceptions parents, educators, and employers have about ADHD and autism? The big misconception about childhood ADHD is that the child is purposely disobedient and oppositional, rather than focusing on their strengths and finding creative solutions for the behavioral challenges in question. For adults struggling with ADHD, the big misconception from employers is that the employee is lazy, is not committed or invested in the project, and does not care. For children on the spectrum, the common misconception is that they can't communicate or relate to others, prefer to be in their own world, and need one-on-one help to navigate life. For adults on the spectrum, the common misconception is that they lack empathy and live their lives like the character Spock on Star Trek. Employers often perceive and place adults on the spectrum as working best in work roles that are isolating and analytical in nature, rather than working with their colleagues as an active working group in the workplace ecosystem. How do you identify the unique strengths of children and adults with ADHD or autism, rather than focusing solely on challenges? The approach for identifying the unique strengths and abilities of children and adults with ADHD or on the autism spectrum begins with a developmental interview. Charting the progression from prenatal development to their age today is critical, and allows one to understand how their physical, cognitive, emotional, and social developmental milestones unfold. From there, a psychological or neuropsychological test battery, depending on the referral question and what appeared during the interview, is completed, which provides unique information for how the person is functioning compared to their age-related peers. It is often during the test battery assessment that unique strengths, e.g., visual, spatial, and analytical strengths, the observation that movement enhances their performance, the use of mnemonics to transfer information to long-term memory, performance differences during sprints versus sustained learning, observations for reducing stimulant overload, harnessing effective communication strategies, etc., are identified and shared with parents, educators, counselors, and medical providers. What signs should parents look for if they suspect their child may have ADHD, autism, or both? Children with ADHD tend to have difficulty following multi-step auditory commands from both parents and teachers. They tend to be easily distracted in their visual field, and auditory information does not typically sink into their long-term memory stores without repetition, unless it's meaningful or presented in a multi-sensory method. Procrastination is quite common, and planning out the weekly to-do tasks, as well as finding the tools needed to accomplish them, is a huge undertaking, as is showing their work, e.g., on a math test. Internally, many ADHD children have multiple radio stations on at the same time, and the volume and divergence of information processed further sabotages their ability to plan, organize, monitor, and execute, the hallmarks of executive functioning. With respect to children on the spectrum, the classic signs tend to be extreme sensory sensitivities, e.g., covering ears with both hands in response to everyday sounds, wearing soft fabrics such as sweatpants, avoiding foods that are slimy and soft in texture, etc. Challenges with communication, e.g., uncomfortable in maintaining eye contact, expressing little to no gestures when attempting to communicate, difficulty in maintaining a natural reciprocal dance while conversing, socialization, e.g., difficulty knowing how to act in social situations, challenges in experiencing shared enjoyment in group play, etc., and emotion, e.g., difficulty identifying how others are feeling as well as sharing their own emotions. What does evidence-based care mean in your practice, and why is it especially important when working with neurodiverse individuals? Evidence-based care is applying science into clinical practice, rather than just winging it. This is important for all stages: the clinical interview, the testing battery, and interventions selected, as they are heavily influenced by peer-reviewed psychological and psychiatric studies. Without this approach, the counseling experience falls short by clients walking away without the core strategies for change, and the testing experience is limited to one aspect or domain, such as academics or IQ, without fully knowing about the others, like memory, language processing, executive functioning, personality, and so on. How do accommodations at school, work, or home help individuals with ADHD and autism reach their full potential? Accommodations at school do just that. They accommodate or work around the unique learning style differences of the student, based on the comprehensive neuropsychological results. This may be ensuring the student uses different information platforms in class, different aids to stimulate their attention and interest, a process for shifting information into their long-term memory stores, the option to extend time on tests and take regular breaks, reducing noise and stimulation via auditory, visual, and kinesthetic aids, and so on. In the work setting, accommodations often focus on reducing stimulation, allowing for hybrid work-home workflows, ensuring communication is delivered via multiple mediums and the understanding of that information is clear, posting work goals on visual aids, planners, having the right reminder and reward systems set up, and so on. Looking forward, we'd like to thank Dr. Steve Tutty for his insights and wisdom. As he looks to the future, he's drawn to the advancement of neuropsychology as a field, with a particular interest in how the brain regions can be identified on a functional level. The hope is to use that knowledge to understand how different brain regions collaborate with their neighbors, and from there discover novel, evidence-based interventions for common conditions.